Hello and welcome to Caregivers First, the show brought to you by SCAN, Social Community Activities Network, a nonprofit agency dedicated to helping active adults stay informed, empowered, and inspired. I'm Lavelle Jones, your host. We have a great show for you today, so let's get started. It's a good feeling when you can bring home a loved one from the hospital. However, it's important for us to understand that how a patient prepares for discharge can have a significant impact on their continued recovery and health. Today, we're going to discuss how to plan for a patient's discharge. I'm so pleased to have as my guests today two experts in the field of patient care, Beth Rigatti and Karine Schnorhokian. Beth Rigatti is the Southern New Jersey Regional Director of Case Management for Care One. Beth has been with Care One for the past 4 years, and she oversees the social workers in the Southern New Jersey area. Beth has a bachelor's degree from St. John's University and a master's degree in social work from Monmouth University. She's been a social worker for over 10 years in New Jersey, and her professional experience has been in the post-acute setting with a focus on discharge planning and end-of-life care. Welcome, Beth. Karine Schnorhokian currently serves as the Regional Director of Case Management and Clinical Integration at Care One, where she oversees case management and discharge planning for all 21 Care One facilities throughout New Jersey. She's worked as a nurse for over 15 years. She's led several nationally recognized innovative programs. She currently serves on the board for the American Case Management Association, New Jersey chapter, and is very active in her Armenian community. Welcome, Karine.
Thank you for having us.
It's a pleasure to have you both here, and thank you so much for joining us. Before we get into the specifics of patient discharge, I'd like to put it into the context of the total hospitalization experience, if I could. So I'd like for both of you to talk to us a bit about what one should or can expect when they're admitted to the hospital.
That's really an excellent question, and I think we can both attest to either having loved ones admitted, ourselves being admitted maybe for the delivery of a child, and hospitalizations can be exciting, anticipated, but for most of us, unanticipated. And the whole complexities of a hospitalization can be a whirlwind. And you can go in, and before you know it, you're being discharged, and not really sure if you're feeling even 100% or that you're ready to go home. The whole landscape of healthcare is changing, and the dynamics of what we do during a hospitalization is changing as well, where before you may be staying till you're feeling 100% and that everything is all good, and now we're noticing quicker turnaround times, and that you can continue to heal either in a skilled nursing facility or at home with resources in place.
Is the quicker turnaround time because of advances in treatments, or either treatments in the hospital or perhaps what's available outside of the hospital?
You hit it on the head. It's a little bit of both. Okay. And, you know, unfortunately but fortunately, there are regulations, right, to any type of treatment you receive in healthcare. Insurance, a lot of time, kind of mandates and dictates when you are ready to go, even though you might not be feeling ready. They don't look at, my house isn't equipped to handle me being home because I can't do the stairs. They don't, unfortunately, look at all those things.
I see.
You're in there for an acute discharge, acute event, and once they take care of that acute episode, meaning an illness that brought you to the hospital. So whether your chest was hurting or you had pneumonia and you couldn't breathe and you were struggling, once those episodes improve, then you're ready to go.
I see. Okay.
And it really does happen so fast that a lot of times the caregivers are not feeling very informed or prepared for what it's going to look like when their loved one is leaving the hospital. So it's really important that they connect with the right people in the hospital, like a social worker or a case manager, to know what services are either being set up for them or what the care is going to look like at home.
I see. Well, let's talk about what are some of the challenges that patients may face both when they're in the hospital and when they are trying to plan for their discharge.
Sure.
Some of the challenges that they're going to be facing is, as Karine mentioned, it's a very fast-paced environment in the hospital, and they're looking at just that acute medical condition that brought you in. So there's not a lot of time for planning for the discharge, so it's really important that the caregivers come in very educated and knowing to ask questions of their social workers, their case managers, their doctors, their nurses, the whole team that's taking care of their loved one. So that would be a very big challenge if you don't know to ask the questions or who to look for, because most times a lot of the caregivers are getting the phone call, hey, mom's getting discharged. Are you going to come and pick her up, or which skilled nursing facility would you like her to go to?
Yeah.
Oh, I see.
And for example, you know, going back to having a baby. You plan for that, right, for the most part, but you have the anticipation of days. So you have a suitcase packed. You know exactly from the outfits you're going to wear leading up to the delivery and after the delivery how that's going to look like. You have everything ready, or even
you've thought about it for months.
You know, and you've reached out on social media. Have you brought this or that, or even a planned surgery. You maybe researched a facility you want to go to after the surgery, or you have the meals ready to go, you've prepped. When it becomes challenging are those unanticipated admissions to the hospital, which 9 times out of 10 is what we are facing and what we are seeing. So you don't have the bags packed, you don't have your medication list really on hand. Your advance directives may be in the lockbox, right, at the bank, where you only have the key.
Yes.
So those things are things that everybody should be thinking about, being always prepared for the what ifs. And what I mean by that is from keeping a medication list handy. A lot of us are so engaged on our phones. Email it to yourself, right? Have your updated medications. Have your doctor's information on hand. And really, your primary care physician, which it's so important to have one, and to be in touch with, what hospital do you go to? If I need to go to the hospital, where should I go so that I can be sure that maybe you would be there or your partner would be there to take care of me, right? Because your doctor's really going to know your care in most cases. And sometimes that doesn't always happen, right? Hospitals have doctors that only work in a hospital that may take care of you. But these things are really important. It's important to know your conditions and you know, the challenges that may come. And unfortunately, sometimes the most scariest types of news are delivered during that hospitalization.
I see.
Where a new condition is discovered, a new lab value is critical, and a really quick, which is what Beth said, a quick decision needs to be made. Well, you can't do this, we need to do that. Is that what you want?
So I can see where it would be so important for the connection to be made between the hospital, the patient, and the primary care physician. Is it important to keep the primary care physician in the loop on what's going on?
I think in our experiences, we can definitely attest to that. Your doctor should be someone that you can trust, right? Somebody you enjoy seeing, not somebody that you go to him, you know, because you're forced to, right? You should be comfortable in being able to talk to your doctor about these conditions. And though we're talking about discharge planning, we always say your doctor is the captain of the ship, right? And steers your care, but needs to engage you in the conversation and how you want to be treated if the circumstances were to arise.
Okay. Well, let's talk a little bit about planning for the discharge. Let me ask you, when should a patient start having a conversation about the discharge, and who should be involved in that discussion?
And that's a great question that people don't really think about. They wait until they actually get the notice from the doctor that, hey, you're ready to go home or you're ready to go to another level of care. A successful discharge starts on the day of admission, and most people don't want to hear that.
On the day of admission? You
should already start to think about the plans you might need or what you might need to have in place for when discharge comes about, whether it's from the hospital or from a rehab setting. a lot of people will go in with the idea that mom or dad is going to go home exactly the way they were before they went into the hospital, and not having maybe altered goals or altered plans for what if. What if mom isn't independent? What if mom needs a little bit extra help? What if mom can't go home right away and needs to go to a rehab facility or a skilled nursing facility? Starting that conversation earlier on and being really honest, not only with the doctor and the nurse that are there in the hospital taking care of, but the social worker. So that way they can help you really plan for the barriers you might see that are already in that home environment.
And when you say being honest with the doctors and the hospital personnel, what do you mean by that? What do you mean by being honest?
A variety of things. Honest about, a lot of people feel guilty of saying that I need to be the caregiver, or I'm going to let everyone know that I could be the one to take care of mom at home, and not really being honest with, well, I have 2 kids to take care of at home, plus I work, so I really can't be there 24/7 if that's what mom needs. Or mom has had a couple of falls before, and although we don't really like to talk about it too much, maybe there's something else medically going on with those falls. So really kind of being honest about what that landscape of mom's home environment or dad's home environment, what's really been happening, to be able to plan appropriately for the level of care after the hospital.
I see. Okay, excellent. Let me, in the couple of minutes we have before we take a break, let me ask you about something else, and that is, when a patient is discharged from the hospital, they typically either go home or they may go to an alternate level of care. What does a successful discharge plan look like? And by that I mean, what would you want to see in a successful discharge plan?
Do you want to start with that?
Yeah, I mean, first and foremost, communication, right? And being open, like Beth said, about some of the challenges one may have.
Okay.
A successful discharge is really how involved and committed everybody is in the care. And the first person that needs to be as committed is the patient. And as hard as it is, maybe understanding the realities that we can't do everything that we thought we could do. So, you know, the success really comes on good communication, good coordination, and being really upfront, like Beth said, about the realities of what we need. And, you know, we now both work in the post-acute setting where we are taking in patients that have just gone through a really catastrophic illness, right? That's what insurance is for, a catastrophic illness that will result in maybe a decline or a need to get therapy service or skilled nursing services to get better, right? And the success of that is being realistic and being open to your needs so that you can heal as best as you can and manage back in your community or in a new alternate setting.
Okay, those are really important comments because I think as you said, many times we're hospitalized and, you know, it's under sort of an emergency rush situation. We don't think about these things. So it's very important to try to think about them in advance. That's why this conversation that we're having today is just so very helpful. I want to continue to talk about that when we come back, but we're going to take a break, and we'll take a short break here from Caregivers First. And we'll be right back after these messages.
You probably already know that rehabilitation is a must for successful recovery from surgery, injury, or serious illness. What you may not know is that you're free to choose where you go for rehab. In Monmouth and Ocean County, the compelling choice is Care One. Where you choose to go for rehab matters, and with Care One, you have 4 convenient locations to choose from in Monmouth and Ocean counties. Care One at Jackson, Care One at Wall, Care One at Homedale, and Care One at King James in the Atlantic Highlands. At Care One, you'll work with a team of experts to develop a plan based on your needs and goals. You'll have the full support of caring, compassionate physicians, RNs, licensed therapists, and nutritionists dedicated to helping you recover successfully without setbacks at a pace that makes you comfortable and successful in meeting your rehabilitation goals. Once you take the first step with us, you'll never look back. Call 877-999-9999 NOV2019 Care 1 today and come for a tour.
Welcome back for the second half of our show. Before the break, we were talking about a patient's discharge plan. We want to continue that discussion, and I'm going to ask both of you to give us some specifics. If a patient is going home from the hospital, what should that patient's discharge plan look like?
So definitely services to be set up upon discharge, whether or not that might be maybe a visiting nurse service or maybe outpatient therapy, depending on what the needs are. A follow-up appointment with their primary doctor or any specialists that the team at the hospital might be recommending, as well as any equipment that might be needed. A lot of times when a person goes into the hospital, something may have changed with their functional mobility. So was a cane needed to be ordered, a walker, a wheelchair? Is there anything new happening as far as, is there a wound that needs to be taken care of? Is the person a new diabetic? Was there teaching that was given not only to that patient, but also the caregiver that would be in home with that resident or that patient that would be there?
I see.
I want to add, something that's really important to consider and understand is your insurance and your entitlement of services within the realms of your insurance. As much as our communities and the populations that we service feel and see that Medicare is really kind of the crux of how people are insured, it doesn't cover everything.
Yes.
Right.
Yeah.
So
Very good point.
I'm going to plug in the need for having a secondary, right, or the need of considering a managed care if the finances are challenging in the affordability of a secondary. And all that means is just understanding that a hospitalization or going to a rehab facility, those things are covered to a point. But unfortunately, too, there are some limitations. The way things are serviced is all through a skilled need.
So, a skilled need?
A skilled need. So what that means is if this service can not be done by somebody other than a nurse or a therapist, somebody that specializes in these services to manage a wound, manage the therapy of how to walk appropriately with the balance issues that somebody may be facing, then it may not get paid for. So it has to be realistic, and it has to be purposeful. And the way we look at it is it's the right place, the right setting, right, for the right patient at the right time, in the sense of our goals always, whether it's in a skilled nursing facility or in a hospital, is to try and get that patient to an appropriate baseline that's for them. Maybe walking isn't going to be a reality, or being home alone isn't going to be a reality anymore, but finding the right environment to help that individual succeed.
I see.
So, for example, at Care 1, we have a number of services. We have skilled, we have long-term care, we have assisted living, trying to understand the facets of needs for our growing populations.
I see. And let me ask you, as a patient is planning discharge, you mentioned a number of supports or services that they may need. How does a patient find out about those supports and services? Where do they go to get those resource information?
Typically their social worker, if they're in the hospital, their social worker or case manager will be able to try and connect them to those services. You're seeing quite often that when a person is in the hospital, they may be going to a skilled nursing facility afterwards for a short-term rehab stay. It is very important to be, as far as a caregiver, to be known to your social worker, the team that's there, so you can partner with them to have that successful plan. So that way they can assist you with connecting to the appropriate resources. As Karine mentioned, not everything is covered by the insurance, and that's the biggest misconception by most of our caregiving population, is that their insurance is going to cover it. I would say, while it's not a crisis right now, if they're watching, they should be looking into, what does mom's insurance look like? What are her benefits? Touching in on what the financial situation is for mom or dad, because a lot of times it's going to be something where it's going to be an out-of-pocket expense for additional care if mom wasn't able to reach back to that prior level of functioning. You're better off knowing that ahead of time when it's not a crisis, so you can start planning appropriately, so you can take your time. That if the finances look good, you know that you have the ability to hire a private caregiver to come home. If the finances are really struggling and limited, you know that maybe you want to look out for some community support, such as applying for Medicaid or some of the other community services that might be out there. The Office on Aging is a great resource for any of our caregivers or the elderly population. That would, they can also, if you're not in a system, they can connect you to different resources that are available.
And there's an Office of Aging in every county in the state, so it's very easy for patients or their caregivers to get that information.
Yeah, and something to stress is don't wait for the hospitalization. Some of these services do take time. The application process can be very consuming, unfortunately exhausting, and really trying to navigate the system to be proactive, right? We're in our Care One facilities, we're not reactive, we're very proactive, where we need to really have tough conversations sometimes that not everybody wants to hear, but nobody wants to hear that, you know, you need some additional services and you can't maybe necessarily do it. Some things to also keep in mind is, you know, veteran benefits, right?
Of course,
grant programs that your communities may have, volunteering in sort of organizations that can get somebody out of the house, and even within your work, every work has employee assistance programs that, let's say you are a caregiver for mom. We call a lot of us in the sandwich generation, right? We have aging parents and we also have maybe children that we care for. So we're kind of stuck in the middle of balancing all of the demands for our kids and for now our aging parents that are, you know, living longer and maybe making it on their own a bit more, but having challenges. And that causes a lot of stress for older adults who are trying to manage as best as they can in that sandwich generation. So knowing that even your employee offers support if there is stress or caregiver breakdown, because the last thing we want to happen is that individual to get harmed because the stress is so exorbitant that they can't handle or manage.
And that really ties back into when I was saying be honest with your case manager and social worker. If you have these constraints and you know that there's something that's going to be hard for you to take care of mom or dad at home, be honest and be open to having multiple plans. Maybe mom can't get back to being independent, maybe she can. But have that plan for what happens just in case. So that way you're not stressing about all of the different demands that you have on you as a caregiver and feeling overwhelmed and burdened. There's geriatric case managers that are out there, that are patient advocates that you can basically hire to do some little extra assistance for you, but there are definitely a lot of resources that are available.
And I love how you mentioned plan for the just in case, because I think very often that's a point that we definitely overlook. I want to go back to something that was said in the earlier segment, and I just want to emphasize that a little bit, and that is the role of and the need for the primary care physician to be connected. You know, when we leave the hospital, we don't necessarily want to see another doctor anytime soon, but why is it important once we leave the hospital to soon thereafter check in with the primary care physician?
So something we're faced with in the healthcare arena is a readmission.
Oh, yes.
So we always love to see you, right? Come in anytime to see us, but maybe not in 30 days, because there are even penalties that hospitals, skilled nursing facilities, even home cares are now faced with this revolving door of a readmission. And what that means is, you know, a lot of times when you're discharged, you're not going to feel 100%. You may get scared, you may get anxious. Maybe you didn't, you know, it was kind of like a Charlie Brown segment where you just kind of heard the wah-wah and didn't really understand the medication change or the need to follow up immediately. So readmissions are so important to understand and try and get a handle of as the healthcare system as well as caregivers and families, because it turns into then a stair step. And what I mean by this is you're feeling 100%, you're feeling great. you get hospitalized, you kind of go down just a little bit. You go home, you're not feeling quite well, you go back to the hospital, you're kind of going down. So maybe you never really achieve back to that top of the step. And every time you're going down just a little bit more. And we don't want to make it sound grim or the end, but the most important thing we can empower our patients and our families to do is get into the doctor's office as soon as you're discharged. And yeah, you may have just seen him in the hospital, but did you really have the time to sit down with them and go over what transpired? What are these medications I'm taking? I had a lot of fluid in my legs. What does that mean? What do I need to monitor? So the rule of thumb, the encouragement now is not even waiting 2 weeks. We've always heard, oh, follow up with your doctor in 2 weeks.
That's what I'm familiar with.
It should be really 5 to 7 days.
Okay.
Where you should be proactive, get that appointment in. And if your doctor cannot see you in that time frame and they know that you were just hospitalized, that's another conversation you need to have with your doctor. It's important for me to see you. And if they're not taking the time, maybe then you even need to revisit your relationship with, the doctor. Now, I'm not saying leave your doctors altogether, but it's so important to see that doctor so soon after follow-up. Certainly go off their recommendation. If they say, no, you're okay, we can follow up in 2 weeks or so, then that's okay. But really, for a real catastrophic event, which most hospitalizations unfortunately can be, really that within a week you should be following up.
That is terrific advice. Thank you so much.
Of course.
This has been such a wonderful discussion, and I don't want it to end, but unfortunately we have just about a minute and a half left. So I wanted to ask both of you, any final thoughts or recommendations or advice to our viewers on planning for patient discharge?
One thing that I would definitely recommend is following up and having a conversation, parents and children, or whoever the caregivers might be, because you might have a friend that's a caregiver for a neighbor. Have that conversation with your potential patient to know what their wishes are, to know what their insurance looks like, to know where their pertinent documents are. An advance directive, you're going to be asked about that anytime you go into a hospital. Have a copy in your pocketbook, have a copy in your wallet. As Karine mentioned earlier, email it to yourself. It's very, very important because most hospitalizations are something catastrophic, and you might not be able to make your needs known. You'd really want to have that written out there and be able to direct your caregiver.
Terrific, thank you. Karine, 30 seconds.
I think we were talking a little bit during the break also, just making sure you have a good patient advocate. Good telephone numbers. Having that information, we're facing a population where memory, cognition, Alzheimer's, dementia is becoming, unfortunately, part of the norm. And maybe we don't realize it until that loved one has a hospitalization, but making sure the telephone numbers are reachable, that we know who we can contact. And again, we can't stress enough the goals of care.
Wonderful. Thank you both so very much.
Thank you for having us.
I have learned so much today, so I very much appreciate your sharing your expertise with us, and I hope you'll come back in the future.
We'd love to.
Thank you very much. And thanks to all of our viewers for spending time with us today. I hope you found the information useful. If you did, please share it with your family, friends, and neighbors. It's been my privilege to be your host today, and I do hope you'll join us for the next edition of Caregivers First. Until then, take care.